I now request Mr. Upender Singh, Managing Director, West Bengal Electronic Industry Development Corporation Limited, Webel, to share his vision with us. Sir, a big round of applause for him.
Thank you for inviting me here. Thanks to Elets. Eminent panelist and distinguished guest, since I'm from Webel, and Webel is a state nodal agency for IT and electronics, I would talk about how ICT can, help the healthcare industry in providing more services to the citizens of the country, as well as to the, patients. So ICT has been widely used in the healthcare industry for last 1 decade in specific, and generally last 2 decades, ICT has played a major role in the healthcare industry. And there have been, a unique kind of, propositions by, various offerings in the healthcare practice. Specifically, there are a wide spectrum of, issues like patient safety, dietary management, telemedicine, digital imaging, document management, etc. And there are, technologies used in the current timings, like the electronic health record, where most of the hospitals are using it, then hospital management system, hospital information system, clinical decision support system. It's something in the telecom, world you use OSS and BSS. So in the healthcare, it's clinical decision support system. Picture archiving and communication system, generally used as PACS, which is for archiving and retrieval of all the digital imaging system, like X-rays and other things. And then barcoding is another area which is used extensively. RFID, radio frequency identification, is also used a lot in the healthcare industry. One thing which is of huge importance is telemedicine, telehealth, which we are also working in a very big way. As a state nodal agency, we are one of the few states which are doing the NOFN project, National Optic Fiber Network project. So this project is from the Universal Service Obligation Fund. Initially, it was a 20,000 crore fund, which was allocated for rural development, and also to have fiber optic to the Gram Panchayat level. This project, there was a SPV formed called BVNL to implement it, and in 4 or 5 years, there wasn't much progress. So the center decided to give it to the states to implement it. So West Bengal is one of the few states which have agreed to do it, and Webel will be implementing this project for the state. A huge budget for this project, a little less than $1 billion. And we would be, implementing this project. Now, the benefit of this would be, once we have rolled out the optic fiber network till the Gram Panchayat level, with huge bandwidth and network available, the possibility will be enormous. And huge amount of applications, healthcare applications would be run across the network. Telemedicine is one of that, and which will have reach out to the rural area, up to the Gram Panchayat level. And they will have connectivity with the major hospitals, and the remote healthcare facilities will be able to be provided to the remote locations. So that's going to be very, very interesting over a period of time. And this will also, save a lot of lives and give a lot of, importance to the rural area in terms of. Another important area is mobile health. M-health is another thing. Now, if you see, there are major amount of, there are a lot of, hello. So in terms of creating health dashboards, there are health dashboards. There are a lot of sensors in a mobile phone where you can have health data, which can be measured and passed on to the doctor for analytics. So that's also quite useful and helpful. And then the most important thing among all is the analytics. Analytics in the healthcare. That's going to play a very large role because the data is there. There's so much of data that's there, but analytics is more important. We are not able to analyze things. So, for example, a particular area in Calcutta, there are a lot of patients having dengue, or likewise, there's some epidemic happening in some area. With analytics, that can be analyzed and that can be, looked at, and likewise, within the various reports, medical reports, using analytics, you can have an easy diagnostic of healthcare. So broadly, with this, I would end my part, and I would just like to say that it's just a matter of time that ICT can play such an important role. And if you had seen Star Trek and the kind of medication these guys had showcased there, it's just a matter of time. You'll have that kind of medication kind of stuff coming up soon. Thank you.
Thanks a lot, Mr. Upender Singh, MD Webel, for sharing his vision on how ICT can be used for healthcare sector.